Hi, I'm Naomi Murphy, and this is the Locked Up Living podcast, where we talk with a wide range of people about harsh aspects of institutional life.
We also explore some of the ways to overcome them and to grow and develop. I'm David Jones. So join us every Wednesday morning, 6 o'clock UK time, for a fresh podcast.
Today we're talking to Lee Powers, who's a nurse, an intensive care unit and workplace violence survivor and international speaker who's using her story to drive change. Lee brings powerful insights on ICU recovery, workplace violence and personalised medicine, combining clinical expertise with the lived experience of surviving the very system she once worked in. I really feel very privileged to get the chance to talk to you today, Lee. Welcome.
Thank you so much for having me.
Hello, Lee. Very nice to meet you. Thanks very much for coming along. So, Lee, you were the victim of a workplace assault that dramatically changed your life. Can you tell us a bit about that, how it happened, what happened?
Absolutely. So I was going into a shift in the hospital and I worked 12-hour shifts and happened to be working these shifts right as I was completing my nurse practitioner degree. So I put my scrubs on that evening, grabbed my study materials and books and proceeded to the hospital where I always got there early and I would, read and study and kind of prepare for my shift. The shift started like any other night, but it certainly ended quite differently. We were quite busy that evening. I worked on a psychiatric intensive care unit, was preparing for my shift and started the shift. And like any other day, we were extremely busy. We only had one nurse in admissions that night, which is problematic because then the admissions paperwork does not or did not get completed. And some of the nurses who were working on the floor, me being one of them that evening, would have to accept a patient without having a complete picture of their background. And so that was kind of the first step in the process that was quite dangerous. But anyway, went through the shift and I had gotten several admissions consecutively. And around 3 a.m. in the morning, I get my last patient of the night, which happens to be the patient that assaulted me. I did not receive any history on the patient other than just a very cursory what she was there for, and did not know that she had formerly assaulted 6 other people in other institutions prior to joining us that night. Also did not know the extent of the violence that had been perpetrated on other people. But at the time when I accepted her as an admission, she was calm and there was no indication that what was about to happen would occur. I introduced myself, said hello to her, and offered a prescription that the doctor had prescribed as an option for her. And she jumps off the couch, grabs me with no indication or warning, and says she wants a different medication. And before I know it, I am being slammed into a concrete wall and pretty much in shock at that point. So that's kind of the setup for what happened that particular evening.
So, well, that was obviously very frightening and shocking. So, but what you're saying is that this person had assaulted other people, and there must have been a record of that, but it somehow didn't get to you. Is that
Correct.
right?
Correct. Yes.
So, I mean, I don't know a huge amount about facilities in the States. Was this a state facility or a private facility?
It was a privately owned facility, so it was not run by the state.
Right. So, do you think that there were any implications arising from that?
Well, so that's a little tricky in the United States, and it's also very specific to the state where one works. One of the things we do not have in the US, and I would definitely like to help change, or at least at minimum bring awareness to, is we don't have a standard for laws across the country for assaulting healthcare professionals. And that's problematic. I just gave a talk a couple weeks ago in New York City at the Triad Theater, and the stats that I had at the time were that healthcare professionals are 4 times as likely to be assaulted as other professions. However, there is new data, and it's actually 5 times the number of other professions. So having said that, whatever we're doing in the States, it's not working. And we do need some standards, in my opinion, about laws that protect nurses and other healthcare professionals so that when they are caring for patients, we are safe. And kind of the statement that I live by is, if the nurse isn't safe, no one is safe.
Very well put. So what was it like, Lee, initially to be left with such life-altering consequences from this assault?
It was devastating. Went from preparing to meet, I had a trip scheduled to Chicago to meet my fellow colleagues and nurse practitioner students that I had studied with, and went from planning that to basically ending up in the ICU and on a ventilator, needing, support to breathe and all kinds of other complications. So through that process too, there was definitely financial challenges, which I don't think we talk about enough when someone is critically injured. We may, as healthcare professionals, focus on saving lives, but what kind of life are we offering to patients and support are we offering when they recover from an illness? So financial concerns were very much relevant in my case and in so many others. Relationships, my relationship of 30 years dissolved and was not able to withstand the multitude of stresses that came from that. There were obviously physical challenges. When I left the ICU, I had to learn how to walk, talk, care for myself again. I couldn't concentrate. I couldn't read an article and understand that. And for someone who's always been a researcher at heart, that was very difficult just to lose that capability, which was kind of my go-to for my entire life. Friends, some stayed, some did not. Again, understanding that life-threatening situations cause stress not only to the person, but also to your community, and certainly impacted my community. And I actually lost my home. So I was never homeless in terms of, luckily, I had good support and I had places to stay. But the devastation was pretty total, almost complete. The only thing that I did not lose in my kind of frame of reference was my life. And I'm exceedingly grateful to still be here. And as part of kind of my bargain, we can talk in a little bit if you want more about the actual coma, but there were some things happening in the coma that felt like I had a choice whether to stay or go. And if I was going to stay, a promise I made to myself is that I was going to talk about this because I didn't want anyone else to go through the experience that I went through.
Do I understand you correctly? Are you saying that whilst in the coma, you still had some kind of internal dialogue, internal experience?
Yes, that does not happen, as you know, all the time and can be somewhat unusual, especially given the strength of the medications that one receives when one is on a ventilator and is in intensive care. However, for whatever reason, I was very much aware of almost everything. And that experience was in and of itself really very terrifying. But I very much concentrated on trying to remember the things that were done, and maybe even more importantly, the things that were not done, so that I could, if I did survive, which I wasn't sure because I knew something had gone really terribly wrong, but if I did survive, I really wanted to talk to healthcare professionals, families, etc., not in a punitive way at all, but to say, hey, when you're on the other side of the bed, here's what a patient may experience and may feel like. And I didn't know that this could be happening, but here are some things that we can do collectively to lessen the trauma for these patients if they are capable of understanding what's happening to them, or even in small bits of time. One doesn't know. So let's always assume that the person in the bed, the patient, can understand what's happening and what are things we could do that don't require expertise and don't require special equipment, but require just the knowledge that let's treat people as human beings and give them that same respect that you would if a person were fully conscious.
I'm really struck, Lee, by your incredible resourcefulness that you had that process going on whilst not conscious, and just think what an amazing person you are. But I wondered if you could tell us about some of the experiences that you had that you were like, this isn't right and this needs to.
Sure. So one thing was there was constant people obviously coming in and out of my room. And I became very heightened to the sounds of footsteps, because footsteps meant people, and that would mean pain. And I couldn't understand what was being done or why it was being done. So I wrongly assumed that I had been abducted and that they were going to harvest my organs. But there were reasons for that. It wasn't purely like delusions or hallucinations that people talk about. It literally was, I had a fever of 105 degrees. So they put me on cooling blankets. But when the staff came in, no one told me, here's what we're doing and why. My mouth was pried open, and I heard the sound of what sounded like a drill. So I'm assuming they're taking my teeth, and maybe next are going to be other organs. But that was the electric toothbrush. I knew it was stainless steel, but the whole time my brain is just trying to figure out, where am I? What's happening? And so there was kind of a constant trauma of, physical alertness. And that took months. It took several weeks before I could even sleep when I finally did awaken from the coma. And it literally took years. I woke up every night screaming for at least 7 years afterwards. And so just the care, I do want to mention one other thing. There was constant cleaning. I was given a stool softener. And again, when you're the patient in the bed, you don't have the opportunity to say, I don't want that, or, hey, it's not appropriate at this time because my stool's plenty soft right now. I don't need more. But there was no one to advocate for me. And so I got the stool softener daily, which then caused constant cleaning. And the covers would be ripped off, cold washcloths, and I had sores on my body and open. It just was really quite horrible. And I remember thinking, where are the warm huggies? Like, this can't be happening. But it did. And there are just other ways to do that. One being, if one person had thought, is this medication appropriate? And maybe, let's cut down on it. But when you can't speak for yourself, you really do rely on other people to take notice and make adjustments in the medication regimen.
So it sounds from what you're saying, Lee, because you were in this perceived to be unconscious state, there was no offering of comfort or warmth, just the sort of mechanical operation of what people thought you needed. Is that right?
Mostly, I would say most of that, like 90% of the time, that was the case. There was one doctor, and I will credit her for saving my life. She came in daily when she could, held my hand and spoke to me and used my name. So at those moments, I thought, maybe I haven't been abducted. Maybe it is going to be okay. And so that was very, very valuable. But for the most part, most of the staff and the day-to-day operations of what needed to be done task-wise, I was not acknowledged by my name or as a person.
Thank you. That's an incredibly powerful account you've been giving us here, there, Lee. And in particular, I'm struck by how you've put across so powerfully the multiple effects that this incident had on your life, financial, relationships. It sounds like across the board you were affected.
Yes, definitely.
So apart from not being as warm as comforting as they might have been, how did other staff respond to what had happened to you?
Well, initially, staff at where I worked was talking to me until they were told fairly early on from my employer not to speak to me. And that was difficult because unlike, the experience, although it's different, obviously, than going to war as a service member, it felt like, a war had just happened in my body and my life. And so I really relied on coworkers and friends and family and my community to help me through, because something like that had never happened to me. And I think there was a level of disbelief in my own mind, like, this cannot be happening to me. This must be a dream, a nightmare. I'm going to wake up and find that this is not occurring, but it very much was occurring. And so when coworker support was pulled from me, that was very, very difficult. To give you a little bit of context, I had just completed a performance review at my facility, and I had gotten all of the highest accommodations and marks, if you will. And there were some conversations going on at the time where the director of admissions wanted me full-time in admissions, and the director of nursing said, we can't lose you from the floor. I'm not saying that for any other reason except to establish that I was a very good worker. I was excellent at my job. And if it could happen to me, it can happen to anyone. That the moment I was assaulted, I became damaged goods, if you will. And support was pulled, and not only was I not offered healthcare in an expedient fashion, but there were barriers set up to make sure that I was not able to access them in the manner that one would think. And that was very distressing and disturbing to me. And again, couldn't believe that it was happening.
Do you think your employers were worried about possible litigation?
Absolutely. I think so much in the US is governed by worry and concern about litigation. That's one reason why we probably have more lawyers than most other countries in the world. But the bigger picture, I think, is we can, in my opinion, reduce litigation not by hiding and not talking about these incidents and not talking about how we can help people get back to work in an expedient fashion with the best healthcare that we can. But you can reduce liability if you do the right thing. And that may seem a little too optimistic, but I really believe in my heart of hearts that that's the truth.
What other ways did your employers respond to you and to the incident?
Well, they deleted the videotape of my assault right when it happened. And I was told that they did that. It wasn't the only time. And from my understanding, I can't say a whole lot about it, but this is a process that occurs in the US, and that's publicly available for people to find should they want to look into that a little more. And so that was a concern. At that moment, I think there was something in my brain that let me know this was way bigger than me as the individual. This was maybe a systemic issue that was happening. And that realization just allowed me to just go inward a bit and focus on the steps that I needed to take medically to get better, because I knew I was really on my own with that and could not rely on any external help. It took 3 months for me to see a doctor. They sent me to urgent care, and I saw nurse practitioners and physician assistants. When I did see a physician, it was not, I ended up needing a hand reconstruction as one of my injuries, and I was not sent to a hand surgeon. I was sent to a knee surgeon for severe shoulder and hand injuries. So there were some things about the care that led me to have more permanent disabilities that could potentially have been eliminated had I received appropriate medical care in an expedient fashion.
That sounds like malpractice to me.
It does. It does. It does. And again, I can't say a whole lot about it except to say it should not happen. The state in which one works makes a huge difference in terms of any potential liability, if you will. And so there's kind of a mishmash of different options. The state that I was in happened to be Texas. And in Texas, it is currently, and was at that point, the only state in the entire country that does not require workers' comp. So meaning that it's optional for an employer to provide care to someone if they're injured on the job. And that goes well beyond healthcare. So if that just sets the stage for how the state in which one works can determine how you're cared for or not, I think that, and the only reason I'm mentioning it is I was very naive about all this and I just didn't know.
Thank you. When did all this happen, Lee?
In 2014, sure.
Yeah, I mean, it's so atrocious that you just wouldn't even think that that would be possible. You'd assume that there would be a responsibility to provide healthcare and compensation after an incident like that. So I can understand why you wouldn't have checked it out, because it just seems like a basic. But how have you coped with how you've been treated?
Well, I think, first of all, the physical challenges were so much that really all I was concerned about for years was putting one foot in front of the other, leaving the hospital, again, not being able to walk. So just very small concrete steps. What can I do physically to recover? Obviously getting therapies, both psychological and were pretty much found on my own because I wasn't sent home with, like, how do you go from being in the ICU to caring for yourself at home? So that's a missing piece for other patients that I hope to be able to help with in the future. But in terms of my own recovery, it was very small steps over time that took years. And quite frankly, in the past, I'd say in the last 6 to 9 months is the first time that I'm reopening my life. People say, social media and all that. Well, I had no social media that anyway had to be deleted after my assault. And so it was like, how do you start as, pretty much a senior person? How do you restart your career over again and your life? And it's taken this long to do that. I'm not sure I have the answer. I'm still figuring it out, but I am reopening the door of my life. And in that respect, it's a little frightening and also exciting because I'm thinking more about the possibilities to help others and not focus, I don't mind sharing my story at all, but, as I move into the future, I'm very, very excited about what we can do to improve care for other people. And also, what can we do to improve safety worldwide?
Yeah. What effect did it have on those around you, Lee, your family and friends? I mean, you mentioned you ended up with your relationship breaking down.
Yeah, so my previous partner was not used to doctor's appointments every day, sometimes multiple ones. He was not used to multiple surgeries and wasn't really suited as a caregiver, which I cannot fault anyone for. One day, life is one way, and then all of a sudden it's not. And then not only that, but not really having an end in sight was difficult both for my partner and friends, because I think perhaps like with COVID and the pandemic and people that have gone through critical illness, it just takes its toll on everyone, and the constant nature of care that's required for this or something, like pandemic survivors is just so total that it can be overwhelming to everyone around.
How have you moved through the transition from how you were living your life previously to how you're living your life now?
Well, it's been a slow process as well. After I lost my home, I had help, because if I didn't, I really would have not had a place to live. So I lived a little bit in hotels. I had to spend a couple of years in senior living facilities because I was unable to cook for myself. I couldn't stand very well. I couldn't handle, daily tasks. I am living independently now. I'm very happy to report and take care of myself well. I still don't drive. That is a goal that I have to, maybe add that skill back into my repertoire sometime soon. And I do sometimes still require some help, but I also relish the independence that comes with having some agency over my life again.
What have you learned about yourself in that process?
I learned that I'm much stronger than I thought. I'll also say it's a good thing. I didn't know, like at the beginning, I think our brains are marvelous, and I kind of have a regimen where I thank my brain for protecting me and not giving me the full picture of like, this is going to take almost 11 years to get to this point, but kind of let me feel and experience a little bit at a time. And I think I learned a lot about patience.
So your description is almost overwhelming. But to a more positive note, I understand you have a service dog. Is that correct?
I do. He's a Labrador retriever, and I named him Nelson Mandela. And if you have any questions about that, you can ask.
That's a good name. It's a great name. I'm not sure that Donald Trump is so keen on it, but anyway, we used to have a Labrador who unfortunately died, and is still very much part of the family and the minds. I only have to see a Labrador, and I'm overwhelmed by it. So how do you use...
Wait, can you just ask why you did choose that name?
Yes, sorry.
Because it's not obvious.
Why did you choose that name?
Of course. I think at the time when a service dog was suggested to me, I've always loved animals. So I was definitely open to the possibility. And I also felt very alone and isolated because friends and family can only be there so many hours of the day. And I just thought having a dog as my partner 24/7 might really be a good idea. So in my head, I thought if I was going to theoretically walk alone on this journey, who would I like to have beside me? And the answer that came to me was Nelson Mandela.
Great. Well, that's the answer.
Sorry. When you look back, Lee, what are the things that you've learned that you think actually people could learn from your journey? What could be done differently? What would you like to see change?
I think I'd like to see for health, well, for all people, to research a company before you accept employment, and research maybe to what degree you can find this information up front. I don't know. I just didn't know that it was something that I could have incorporated in my search for employment. So I think just understanding that if you are in healthcare, talk to other people that work there, read reviews, consider safety as the number one thing, because when you don't have that, it makes it very, very difficult to move beyond kind of the Maslow's hierarchy of needs. And there are many times that I would refer when people wouldn't understand me or what I was going through. I'd say, well, I'm down here at the bottom of the Maslow's hierarchy of needs, and I'm trying to get up here, but I'm still stuck. kind of at the base. So I think those things, and in terms of caring for patients, I think there's lots of things that we can all learn collectively, and I'd like to be part of that process.
Thank you. And Lee, can I also ask you, you're in the ICU and you said, I could have gone, I could have stayed or I could go. And I wondered what impact, I don't know what your spiritual beliefs were before it happened, but also wondered whether it changed how you felt about spirituality and what happens after life.
It did. I think the experience that I had makes me less afraid to go. And I think I had some sense, whether, to what degree it was true or not. Yes, I had a sense that it would be easier to go and probably a lot more comforting. I did get that sense of kind of warmth and everything is going to be okay if you just kind of, in a way, ease on out of here. I think that what kept me was also the realization of all these things I had been keeping track of in my mind to talk about. And I felt a responsibility to come back and share, just because there were so many things as a nurse that I didn't know that I didn't know. And I thought, you really, if you are going to survive, and I wasn't sure at that time, and the hospital wasn't sure that I would either, that I would do my best to talk about it and get some collaboration going with healthcare professionals.
Thank you. And it sounds like something really important could come from an awful experience. I mean, it sounds absolutely terrifying while you were there, but there's something really inspirational about your response to an awful tragedy. I'm really glad that you came on today to share your story with us. It's really powerful. Thank you.
Thank you so much for having me. I really appreciate it.
Really good to meet you, Lee. And you talk about this really quite horrifying series of events with such sensitivity and erudition. It's been a pleasure to talk with you.
Thank you, David, and thank you, Dr. Murphy.